And today we will be talking about some relevant guidelines regarding prevention of infection diseases and civil protection in the individual, and then we will open the question section. Let's begin with the technical report. Thank you. Good evening everyone. We have the international scene as we have every night. We can see how the proportion has fell slightly, even though we're still talking about 3/4 of the population who have active symptoms of the COVID-19 disease. And we can see how the Americas now are represented with almost half of the total amount of confirmed cases, while the representation of the European region is slowly decreasing, which is to be expected because they are at the beginning of a de-acceleration process, with a daily diminishing of their burden of disease. And in contrast, we have an increase in the Americas region, and in the upcoming weeks we will most likely become the most represented region in the chart. Here we have the Mexico information. To this day we have 2,439 confirmed cases, over 6,000 suspect cases, 11,000 negative cases, and unfortunately we have 125 deaths. Our geographic distribution, the geographic distribution of the burden of disease is showing some variation. We have some yellow states now, and Mexico City area is in red because it has the highest burden of disease. Now we see the burden of disease represented in a bar chart. Here we have the total number of confirmed cases per state. We have been observing that Mexico City continues to lead the way, and it is important to also take population into account. Of course, the more people, the more infected cases, especially if these people are concentrated in one same geographical location, which is the case for Mexico Valley area. Now we can look at the accumulated incidence rate, which is the amount of confirmed cases per 100,000 inhabitants. And we can see how Mexico City is still leading the way in this chart, with an incidence rate of 6.75, while other states like Quintana Roo, Baja California Sur have also important numbers when it comes to incidence rate. The national average is 1.9 when it talks of when it comes to infected cases per 100,000 inhabitants. This rate will also present some variation in the upcoming weeks as we move forward to phase 2 of the pandemic. The distribution per gender, per sex, hasn't shown any significant variation. We still have a slight overrepresentation of men, while talking about the age distribution, we haven't seen any important variation either. We have an important accumulation of cases in senior citizens, and also an important number of cases in young adults. Here we're looking at this same age group distribution, but taking into account the relation between inpatients and outpatients. 26% of patients have had to be hospitalized, and we can see a noticeable increase in the relation inpatient versus outpatient in the case of over 65 citizens, over 65 years old citizens. So we are experiencing an ascending curve in this regard, which means these cases are not showing only mild symptoms, but they are showing alarm symptoms or emergency symptoms that will require them to have emergency medical attention and be hospitalized. Next slide, we can look at how the distribution of cases by severity. So we have 73% of patients are outpatients. We have a 9% of cases that have had to be hospitalized. We have 13% of severe cases and only 3.6% of cases that are in a critical condition and have had to be intubated. Next slide. We see the distribution of deaths. We have a sustained tendency. The older the citizen, the most likely they are to lose their lives to this virus. And here we see an important overrepresentation of male citizens in the chart. 75% of deaths have been male. Here we have the comorbidity chart. The leading risk factors when it comes to chronic conditions, pre-existing chronic conditions, are hypertension, diabetes, and obesity. And let's remember that over 80% of fatalities have been patients with at least two of these pre-existing conditions. So we would like to remind everyone that if you are someone who checks one or two of these conditions, you should be especially careful to abide by the measures that we've been implementing. Here we have the distribution per state, and in a similar fashion to that we observed in the incidence rate chart, we also have an accumulated lethality rate per state, in which it's not necessarily the same to talk about lethality and to talk about mortality. When we talk about lethality, we're talking about how many people who tested positive for COVID end up losing their lives to it. Another way to monitor the deaths is through mortality, which, as I said, is a different measure, in which we notice a redistribution in the order of states. So here we're talking about mortality, and it's how many people lose their lives to this disease as compared to the absolute population of that state. And here we can also see big differences between states. Last two slides, we see the epidemical curve of accumulated cases so far in Mexico and in other countries. So far we have 2,439 cases in Mexico, so we have a tendency that is going upwards. The last slide is also the accumulated case relation, but we also have the orange bars that show us the incidence burden, the burden of incidence, which is the number of newly confirmed cases per day. So as you can see, for the last 5 days, we've seen also a tendency to have an increased number of new confirmed cases per day. That would be today's data. Thank you very much. Thank you very much, doctor. Thank you. As you know, all of the institutions within the health sector are making proper preparations to be able to provide medical attention for a higher number of patients. For this, we have reorganized the way the hospitals work. We have rescheduled an important number of surgeries that are not urgent. We've also addressed this issue through phone medical assistance, which is important. But there are some areas in which we cannot, we are limited in our capacities to reorganize the logistics of the hospitals. For example, the oncology department, intensive care unit, traumatology, etc. The external consultations of some specialties are going to continue to work in the same way, and in order to illustrate this, we have created a video that we would like to show you. So this is regarding the patients who are outside of the COVID-19 related patients. As an external consultation doctor, your labor is very valuable. Please always use your institutional uniform and your identification. If you are female, you should have short nails, no nail polish, no makeup. If you are male, you should be shaved, no beard, no mustache, short nails, short hair. Remember not to use any personal jewelry, watches, etc. Please do not use your phone during consultation. Before providing medical consulting to patients, please do wash your hands for at least 20 seconds according to the parameters established by the World Health Organization. Remember to keep your distance, at least 1.5 meters, and always use a face mask. The technique to put on your face mask is the following. Make sure you're using the right side. Hold the straps and put them behind your head. It is very important that your hands do not touch the inner part of the mask. Make sure you're covering both your mouth and your nose. If you need to adjust your mask while you're working, use 70% alcohol solution and soap and water to clean your hands. You must use your mask during the totality of your work shift. If you need to cough or sneeze, please cover yourself with the inner side of your elbow. Do not store your face mask in your pocket or in any other dirty surface. After finishing your shift, first wash your hands thoroughly and then remove your face mask by the straps. Do not touch the inner part of the mask and throw it away immediately. You must replace your mask whenever it becomes wet, it shows damage, or it gets dirty. After doing so, wash your hands again. This material is the specific and adequate material for the activities that you will be carrying out within your workplace. If you carry out physical exploration of the patient, you must wash your hands thoroughly before doing so and during the 5 essential parts of the medical care. Store your face mask within a closed plastic bag. We wanted to show you this video because this shows the proper measures to keep your hands clean, store face mask, use face mask, but it's also the kind of procedure that you must follow to take care of outpatients that are isolating at home. We have recommended a specific set of measures to take care of such patients, and this is the equipment that the person who's going to be taking care of these staying at home patients should be wearing. Thank you very much. Thank you, Dr. Borja. Now we will begin the question section. Yesterday we were talking about the disability, the patients that have some sort of disability, and what are the special measures that must be applied when taking care of them. Well, this video specifically illustrates the kind of measures that should be taken into account when taking care of patients with disability and of patients who are staying at home in general. Now let's begin with the questions. Yes, I have 2 questions specifically. First, what procedures must we follow within the police department, given the situation that we've known of some infected police officers within the department? So what should they be implementing? And second question, what are the measures that we must take, or what is the procedure that we must follow in the case of fatalities, if in the case of deceased patients? How are you gonna prevent funerary services from affecting fundamental human rights? Thank you. We have a work group that is being created specifically for the topic of fatalities and funerary services. We talked about, given the transmission mechanism of this specific virus, the biosecurity guidelines that are the ones that are usually followed for the handling of dead bodies do apply, and there is no specific need to alter these general handling of dead bodies measures. All of the funerary service providers that are licensed should know these procedures, should know these guidelines, and we just encourage them to follow them to the letter. They should not refuse any services to any person, and if you get rejected by some of these service providers, you can complain about it. You can denounce them. We will present to you more specific information about the number you can call and what's the specific institution you can refer to in the following days. Talking about the police department, the firefighters team, private security institutions, any task force in general that involves multiple people working together, they present an additional risk of getting infected because of the nature of their work that leads them to be working within crowded spaces. So what are the measures that they should adopt? Well, the safety distancing measures that we've been implementing for several weeks now. But I would suggest, if you're thinking of a specific group, although this is a general recommendation for any corporation, is to use the information that we have presented to the public for several weeks now. All of this information can be found at the official website, and there you will be able to find extensive technical recommendations regarding these measures. All right. Thank you. I would like to ask Dr. Borja, what are the news that you have about the state of Baja California? We've heard that the medical units are being overworked. And Dr. Gatel, I would like to ask you, talking about the amount of people who have died from this disease, I wanna know, is there, because you've reiterated that the deaths always present chronic conditions, but are there any deaths that are actually not patients that are not senior citizens or do not have any of the chronic diseases? Because the way you've been presenting the information, maybe people who are young and have none of these diseases could think that they have nothing to worry about. And also, I would like to know, all of these people died within a hospital, or some of them died outside of the hospital? Also, the drug that was being used is out of stock, but it's gonna be available soon again. So is this gonna be regulated by the Ministry of Health in any way? Yes, in Tijuana we are not overloaded in terms of medical units yet. We have been having a lot of work, but we are still implementing properly the epidemiological vigilance programs and protocols. We have personnel allocated to working specifically on the hospital reconversion program. And I will be presenting a short message to go in further detail of the preparation measures that we are currently taking. Yes, talking about the deaths, if we look at the age distribution, we do have patients of 25 to 29 years old that have lost their lives to COVID-19, though it's a very small proportion. But it is important to remember that the fact of not presenting any sort of comorbidity doesn't mean that you don't have it. What happens very commonly with this sort of diseases is that sometimes they end up revealing some previous conditions that were unknown to the patient. For example, autoimmune conditions. Remember, autoimmune issues could be present in people of all ages, not necessarily senior citizens. If we look at this, if we look at the official statistics, we have three fatalities that didn't have any comorbidity detected when they underwent the epidemiological study. And I would also like to say two things. First of all, even though we have insisted on the fact that 8 out of 10 people who test positive for COVID are only going to show mild symptoms, that is going to be naturally resolved in a spontaneous manner. Please do not forget that there is an enormous prevalence of diabetes within the Mexican society, one of the highest in the world. And this could lead to people who do not know they have diabetes. Maybe they already have diabetes. And they get to know that they have diabetes because they test positive for COVID or at the same time. So a useful measure to identify this possible risk is the relative association. If you're in a family that has previous cases of diabetic patients, then you should be especially aware. Remember, the COVID symptoms are headaches, coughing, body ache. You should be, if you present these symptoms and you have a mother, relative, father, or sister that has diabetes, then you should be especially cautious. The most probable case is that if you're under 40 years old, you probably have a low probability of having diabetes. But if you have relatives that have diabetes, you should be especially careful. The second thing I would like to say is I would like to publicly thank these the official institution that is in charge of training our professionals and design public national health public policy. They are been providing very valuable mathematical models and very valuable data for the monitoring of this pandemic. And we've been working along with this analysis institute in very specific instances like comorbidity rates, for example, of COVID patients that end up dying. And because of having access to this information, we've established that two of the most important risk factors are diabetes and immunosuppression. The analysis is a preliminary one. We're still working on it, and when we have more data, we will have a much more robust analysis. But I would like to thank the Institute for helping us with the reorganization, with the diagnosis process. It is an institution that is always working together with us. Now, the chloroquine and the hydroxychloroquine are drugs that were invented over 40 years ago for the treatment of other diseases. And they have been used in arthritis cases and other similar diseases. Now, unfortunately, when the news started to spread that these two drugs could be beneficial to the treatment of COVID, we had a number of panic purchases that were completely unjustified because there is no medical or scientific solid evidence that these two drugs are actually effective in the treatment of COVID-19. So unfortunately, because of this news spreading so quickly, there was lack of availability of these two drugs in a number of pharmacies and drugstores in our country, and this led to complications in patients of other diseases of other conditions that were treated using these two drugs. So we are evaluating if we are gonna implement some sort of regulation when they become available again. Thank you. Two questions. The first one, I would like to know how many private hospitals have been fined for applying or offering COVID tests without having the proper licensing and registration. And I would also like to know how many private and public hospitals are actually licensed to apply such tests. Well, right now the sanction related um, topic is not really in charge. It's not really something that we at the institute that I'm leader of. We do not handle the punishments or the fines. This is under the jurisdiction of other institutions. But the institutions that do um, provide this testing, they carry out the sampling processes, and they have the proper methodology to do so. And then they can, it's not like they are certified, so to speak, or per se, but they have a comparative evaluation process that allows them to know how to properly implement this testing process. So we have a list of all of these hospitals, and that is constantly being updated, and it's available online. After the conference, we can give you the access to the website so you can monitor it yourself, because this list is constantly being updated. But uh, but there is an important number of private and public hospitals that are qualified to implement this test, and I can present the information to you tomorrow if you want. Yesterday we heard that a zoo in New York, in the United States, determined that at least 6 felines tested positive for COVID-19. If it is the case that animals can also be infected with COVID, how would that affect the current measures that we are implementing? In the beginning of the epidemic, there were also cases in China of animals that got infected with COVID, especially domestic animals. So far, there is no evidence that indicates that this is a generalized phenomenon. Do remember that this virus originally came from other animal species, so it is not surprising that there could be a reverse transmission phenomenon, like going from humans to animals. But so far, there is no evidence to indicate that this is a generalized phenomenon that should be a concern. And talking about the question regarding the funerary services, these guidelines are for the funerary service providers are direct responsibility of the municipal authorities, not of the federal authorities. Now, Dr. Victor Borja has a specific message regarding the security of health sector personnel. We've been concerned about the aggression and the threats and the discrimination against the health sector personnel that's treating cases of COVID-19 that have been manifesting in different parts of the country. As public health sector institutions, we want to express that the health of the people of Mexico rely on the work of these personnel. So it is very important to be empathetic and to show solidarity with our doctors and nurses who are at the front line of this battle against COVID. To affect in any way or prevent in any way the functioning and the work of these doctors and nurses directly affects the response capabilities that are so much required right now by our population. We make a calling to trust the work of our medical practitioners. For us, the integrity, the physical integrity of our personnel is crucial for carrying out with this strategy. So please make the aggression stop. Thank you. Hello, good evening. First of all, today, National Autonomous University of Mexico Medicine Department decided to recall their interns from dealing with COVID patients because they stated that there are no proper training conditions for them to be helpful in this process. This morning, the president talked about the possibility of asking the help of Cuban doctors for dealing with this epidemic. Is there a concrete project regarding this? And why would be asking for this help of these doctors? Is that because we lack proper specialists in Mexico? And also, we would like to know, we've seen the threats online and in social media, but have there been physical acts of aggression against doctors and nurses? Regarding the third question, this is exactly what Dr. Borja is referring to. We have had cases that are isolated cases, but nevertheless are terrible. And they come from a phenomenon that is natural but is unjustifiable, which is fear can lead to irrational responses. And fear can lead to behavior that has no justification because it affects the dignity, the rights, and the life of people. So, and this is even more enraging when it comes to health practitioners, medical practitioners that we are all relying on because they are at the front line of this battle against this pandemic. So we make a calling to stop these abuses from happening, from continue to happen, because we will not allow them. Talking about the interns, yesterday there was a colleague of you who was asking a similar question. The response is the following. The medical personnel that is currently undergoing training, including those that are specializing, they do not have a contract-based work relationship with the health institutions. They are scholarship awardees. They receive a scholarship by different institutions, but the responsibility is a responsibility of the academic institutions that are training them. So it is perfectly understandable that the National Autonomous University of Mexico made this decision. It does create an inconvenience because it decreases the response capacity of our overall health system, but we will search for mechanisms in order to provide the best conditions that allow these interns to come back into the field. It is a different situation where with personnel who is already working properly, who is already hired by the different institutions, because they all have the proper training to deal with this situation. The interns are still students and they have a very valuable role within this situation, but it is understandable that they are not fully trained yet. So we are working on the training of all personnel to be able to implement to the letter all the different protocols relative to the control of this virus. And I would also like to make a call to all the health authorities in the country. Do not forget that the state governments are health authorities. There is a shared responsibility and there is a specific responsibility of each of the state level governments. They should be responsible for the way the health institutions and the health system is working within their states. I would like to mention that from since the month of March, mid-March, all of interns were recalled from their duties when it came to treating COVID-19 patients. All interns within the National Social Security Institute were allocated to different functions, and we didn't let them deal with COVID-19 patients. Cuban doctors or any other nationality doctors, there have been international offerings, including NGOs and of medical help from other countries, and all of these proposals have been put to proper analysis and consideration. All international observers that have approached the Mexican case have realized that what we have been saying so far is true. We do have all sorts of insufficiencies in our overall health system. We are one of the lowest ranked countries of the OECD when it comes to health practitioners and health sector personnel. So this creates a specific need for us to quickly and adequately recruit a highest number of medical professionals. When you ask me, are there doctors in Mexico? Of course there are, but in insufficient numbers. This has been thoroughly documented for several years. There have been international reports that state that Mexico doesn't have enough doctors and medical practitioners to meet the national demand. I would also like to say that there's been a new agreement signed by the Secretary of Health that covers a set of modifications to the previous agreement when it comes to the essential and non-essential activities within certain sectors. Remember that the previous agreement basically states that we have to suspend all activities within non-essential sectors in order to reduce the mobility rates on highly populated areas. This has been a concern to some companies and to some private sector entities because they saw it as an affectation of their economic activity, and in an ideal scenario we wouldn't be affecting anyone's economy, but we are in a situation of national emergency. So it is important that all companies, big and small and medium-sized, do their fair share in dealing with this pandemic. If we loosen the measures that we have implementing in this regard, we will suffer the consequences, all of us. So this is the time for staying at home, to cease activities, to adapt conditions in order to allow workers to work from home. The government has done their share, is doing their share. When it comes to the workers of public institutions, they have suspended all non-essential activities that involve people physically presenting to work, and we would like to ask for the help of the private sector as well. And we understand your position, but we have to reduce the activities to our utmost degree of capability. So only a small percentage of these activities were modified. The status of essential or non-essential was modified, and it's been published now by the new agreement signed by the Secretary of Health. Something that I believe is very important. When it comes to public transportation, specifically the subway system, are there any plans to reduce also the flow of trains, for example? And second question, we have a problem in Mexico that has been a problem for many years, and that is public spitting. Spitting in public. A lot of people spit in public. Is that a concern? I don't think spitting in public or spitting on the street is a public health issue in itself. Of course, it could lead to contagion, but it doesn't really have a concerning influence in the transmission of the disease as compared to other means of transmission, such as shaking hands or touching dirty surfaces. Also, I would like to say that there is no special recommendation when it comes to cleaning your shoes or wearing your shoes. In general, we know that the things that are on the floor, on a floor level, are contaminated by all sorts of organisms. So yeah, spitting on the street is a public hygiene problem, but it's not a national health concern. And talking about public transportation, no, we do not have the need to decrease the flow of public transportation because this would create unwanted consequences. If we focus on the economically active population, the public health measures are aimed at temporarily suspending all work activities because this will lower the demand of people within the public spaces, within transportation means, and within workplaces. If we reduced the availability of transportation, then that would create higher gatherings of people within the public transportation systems. The less availability of transportation, the more people together at once in a train or in a bus. So there are no plans to do that because it would have adverse effects. Thank you. Good evening. My first, my first question is directed to Dr. Victor Hugo Borja. I would like to know what's happening with the supplies for the doctors because we've had reports of several hospitals who are complaining about the supplies. And Deputy Secretary, I would like to ask you about the meeting you had a few days ago, a virtual meeting that you had with the Secretary of Foreign Affairs, with the 32 governors of the country. In this meeting, did you achieve any general measures uh, to address this pandemic? And third question, after April the 30th, what's going to happen? What's going to happen after April the 30th? In the beginning of the epidemic, we did recognize some difficulties when it came to the supplies and the training of the personnel. As today, the personnel has been trained and the supplies are in the process of being fully available. We have 80% of capacity covered by now, and it will rise to 100 during the following week. We have specific areas that we're still experiencing a lack of supplies, but there are very specific concrete areas. Most of the areas have been covered in their needs of supplies. For example, the nurse sector, the kitchen sector, the intensive care sector, the outside consultation sector, they all have proper training and they all have access to supplies. Now, of course, when it comes to supplies, we've experienced some difficulty to reach full availability, and this has happened all over the world. For example, with the ventilators, but we are in the process of fulfilling the demands for supplies. The virtual meeting that you were referring to was very productive, and it helped because one each of the governors were able to express their concerns and their doubts regarding health protocols, regarding hospital guidelines, regarding sanitary measures, regarding the decrease of mobility in hotels, beaches, public spaces. It was a very productive meeting. I do respect, and I've said it several times, I respect the labor being done by all governors in our country. We have seen a great degree of commitment and responsibility displayed by each of them. All right, but do you agree on general meetings, or each state has their own measures? Well, each state has to have a certain degree of flexibility because first of all, they are, according to the law, health authorities in their own, and they have specific responsibility. They have direct responsibility over what happens in the health sector within their states. So they have to adapt the general guidelines to their specific realities. And also because the epidemic is not showing the same behavior in each state. In the Mexico City area, in the Mexico Valley area, it is obviously to be expected that the governor of the state of Mexico and the governor of Mexico City will have to show stricter measures than in other less populated areas. It is early to talk about what's going to happen after April the 30th. We are carrying out a continuous day-to-day epidemiological monitoring, but it is still early to tell. And I would like to remind everyone that these measures are required right now as we are in phase 2, but we will inevitably move forward to phase 3. We will inevitably see an increase in the number of cases, more cases and more hospitalized cases. So this is the moment to act. This is the moment to follow these measures because the transmission of the disease will become more intense. The epidemic will become more intense, especially after April the 30th. So that's why we established the measures since February. They started being implemented on March 23rd, and right now is the moment to act. We have considered, and this is included in the treaty, in the agreement signed by the Secretary of Health, that we will work in cooperation with the Ministry of Economy and the Ministry of Work in order to coordinate a set of measures, continued measures for the control of the epidemic. But it's early to tell whether they will have to be more strict or less strict. Depends on what we do today. Dr. Borja, how many patients have you received? How many disabilities have been issued? Are the medical units saturated currently or not? We were hearing about a case in Oaxaca that involved a delegate that tested positive for COVID-19, and then he ran away, and nor only did he run away, he also spat on the patients around him and the medical personnel as a complaint for not receiving immediate treatment. So, could you comment on that? And these people who have died so far, why did they die? Well, at IMSS, we have near to 18 million medical consultations every month. This number hasn't shown any decrease. What has varied is the proportion of respiratory complication related cases. Over the weekend, we attended near 10,000 calls to give medical counseling, and out of these 10,000, only 600 were advised to seek in-person medical treatment. All of the other ones were outpatients. Talking about the delegate you were talking about, I'm not informed about the situation, but I will ask about it and we can talk about it tomorrow. Talking about the deaths that we've had so far, including these 3 deaths that didn't have any pre-existing conditions, the cause of death has been pulmonary complications, pulmonary disease caused by the virus. These pulmonary complications originated by the virus limit the access to oxygen and eventually lead to death. We do not always carry out a post-mortem study. That really depends on the will of the family, but in the cases that we can, we will be examining the bodies. That's it for today. We're out of time. Please do stay at home. Stay at home. This is very clear. Let me be very clear. The epidemic has not finished. It's not over. It's actually just about to enter its most intense phase, and 2 or 3 weeks from now, we will be experiencing a very increased, very intense, very fast transmission rate. So let's do our best right now. The sacrifice that you are all making by renouncing certain needs, renouncing certain activities, and I'm talking to the private sector, the public sector, and the social sector, all of you, we know this is a very big sacrifice. But if we all work together and maintain this sacrifice, because we still have several weeks of these measures, but if we work together, we will be able to flatten the curve so we can avoid the highest number of deaths we can. Thank you very much.